Which of the following sites is the best position to auscultate this defect? It's a 31-year-old woman. She presents to the clinic with shortness of breath, palpitations, and fatigue. She has had these symptoms over the last several weeks. She has been tolerating these symptoms until last night when she could not fall asleep due to palpitations. She has past medical history of infective endocarditis from 6 months ago, successfully treated with antibiotics. She doesn't smoke, doesn't drink alcohol, her blood pressure is 138/89, her pulse is 76, regular. Cardiac exam reveals a soft S1 to S3 gallop, soft S1, S3 gallop, a hyperdynamic apex beat, and a pansystolic murmur that radiates to the axilla. What murmur is being talked about? Pansystolic murmur radiating to the axilla. It's MR, that is mitral regurgitation. So what is going to be answer? What is the mitral area? Where would you auscultate this murmur? So it's going to be a fifth intercostal space in the mid-clavicular line on the left side. The patient is suffering from mitral valve regurgitation, and then you have different types of. So where do you see, what all murmurs do you see in the mitral area? And what are the murmurs that you get in the pulmonic area? That's your second and third left intercostal space. And what are the murmurs that you get in the aortic area? So most important is AR. You have to know where you will get the AR murmur. Is it the aortic or is it the tricuspid area? And in which scenarios it is which? Super high yield people. Let's talk about the different types of murmurs in all of the areas. Super important, and I want you all to be well versed with it. So let's talk about, can you tell me the murmurs that you're going to find in mitral area, and tell me which is the systolic and which is the diastolic. Okay, mitral area first. Mitral area systolic murmur. Very good. So mitral regurgitation and mitral valve prolapse, both of them are systolic murmurs. In mitral valve prolapse, what is the characteristic finding, like the characteristic audible noise that you're going to hear? You see opening snap, that is in mitral stenosis. Okay, the mid-systolic click that you get, it is in mitral valve prolapse. Don't confuse between the two. Never make this mistake. One is systolic, other is diastolic. Mitral stenosis is a diastolic murmur. Okay, so the two most important areas, I think pulmonic, nobody is going to ask you. Okay, they ask you mitral and they can ask you tricuspid. So I want three murmurs that we get in the tricuspid area. And again, like which are systolic, which are diastolic. So the one actually I was going for was the ventricular septal defect, and it is a systolic murmur. Tricuspid regurgitation, again, it's a holosystolic murmur, and tricuspid stenosis, it's a diastolic murmur, right? What about tell me, where would you find the murmur? What is the most classic location for the murmur of aortic regurgitation? It's the left sternal body. You do not get the aortic stenosis murmur in the aortic area, which is actually your second and right intercostal space, right? You get it in the left, on the left sternal body, somewhere around here. Okay. Now, last and very important question. Tell me, where are you going to find the murmur of HOCM, hypertrophic obstructive cardiomyopathy? So you get it in the third intercostal space. Okay, it's on the left side, and you get it specifically. So you get both of them are actually systolic murmurs. Okay, so your aortic stenosis and your HOCM, both of them are going to be your systolic murmurs. How are you going to differentiate between the two? The aortic murmur is going to radiate to the carotids, okay, but your HOCM will not radiate, right? And it's going to be one intercostal space lower. The aortic stenosis murmur you get in the right second intercostal space. However, the HOCM murmur you usually get it in the third intercostal space, and it can be both on the right side and the left side. It's actually more common on the left sternal border. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.